So let's take a look at tier 2 assimilation. So as Patty mentioned when she went through the model, this is the heaviest tier. This is where we expect the orientator to spend the most time. So the examples here are demonstrate principles for safe medication administration, summarize CLABSI, CAUTI, fall, pressure injury prevention interventions, explain the differences between non-restraint devices, restraint alternatives, and physical restraints, identify resources to safely administer and document blood or blood components. Notice that doesn't say that they're actually administering blood, because that's not a competency for every single inpatient area. So we just want to make sure they can identify their resources, and there's other statements to match that. Identify, access, utilize manufacturer's instructions for use. So this is really important because as a nurse comes in contact with so many substitutes in our environment as things are out of stock, it's really important that we always reference those manufacturer's instructions for use before we use a product so that we understand how we can use it safely. And then demonstrate proper body mechanics and use of safe patient handling equipment. So those are the Bloom's verbs, again, highlighted as Patty mentioned before in her tier 1, but these really fit alongside tier 2 as we're moving more into that realm of what they need to be able to do, demonstrate, identify, explain. So we're going to use the same background that Patty did, that 49-year-old patient with an appendectomy. And he came in the surgical unit at 4 this morning. And so our initial assessment on this particular day is that we're in an anchored state. The preceptor and the orientee enter the room together. The orientee takes those vitals, they perform that head-to-toe assessment with a level of consciousness check this time, and they look at the PCA pump for the dosage by the patient. And that's appropriate because we're in tier 2 and this is where we're doing medications. So the orientee immediately alerts the preceptor to a change in the patient's vitals from what had been previously documented 0400. So we see now that our blood pressure has dropped from 122/76 down to 92/58. We have a drop in heart rate from 75 to 64. Our pulse ox even dropped from 98 to 92. So the orientee informs the preceptor that the patient is also slow to respond. So there's that level of consciousness check. So at the top of the screen, this is the competency statement. It says, explain warning signs and symptoms of IV opioid-induced oversedation and or respiratory depression and relate the importance of early detection and timely intervention. So based on what we saw happen here in the scenario, we would say that we trust this orientee to do this KSA independently. They've done everything appropriately based on if that patient had an IV opioid and as far as what they were able to identify and be concerned about.